Hello and welcome back to our channel. I'm Dr. Tafari of Sekhmet Medical Center, helping to simplify your health. Now today we're going to be talking about vitamin D deficiencies and why it's so prevalent worldwide. Now 50% of the world, across ethnicity, across all ages, is known to be vitamin D deficient. That's 1 billion people worldwide. Now this is a big public health concern because low vitamin D levels is an independent risk factor for lots of morbidity and mortality. Now, diseases you get from having low vitamin D levels include diabetes, erectile dysfunction, heart disease, breast cancer, cancers of all sorts, schizophrenia, osteoporosis, and respiratory illnesses of all kinds. So, why is it that we have vitamin D deficiency even though we eat foods with vitamin D, including salmon, egg yolk, sun-exposed mushrooms, tuna, herring, and we get vitamin D from our skin? And yes, it's from our skin. Vitamin D does not come from the sun, it's produced in our skin. That's our main form of vitamin D. What happens is the sun produces UVB rays that penetrate the skin and allow vitamin D production in the lower levels of our epidermis. Now, the vitamin D that we eat or that we get from our skin is an inert form, it's not an active form. That vitamin D has to get hydroxylated in the liver and then further hydroxylated in the kidneys before it becomes an active form that can be used by our bodies. If you think about it, if you have a kidney issue or a liver disease, you're at high risk of having vitamin D deficiency, but this is beyond the point. Let's get back to why it is that we have vitamin D deficiency despite all this beautiful sunlight. Two main reasons. One can be pollution related. Atmospheric pollution decreases the amount of UVB in the atmosphere, therefore reducing the amount of vitamin D that our skin is able to produce. Two, and the main reason is lack of exposure. Why are we lacking exposure of sunlight? Some people live in cooler climates where it's very cold sometimes and it's very hot sometimes, so they don't go outside much. So that's one way. Or two, some people use a lot of sunscreen, preventing UVB rays from getting to their epidermis and providing vitamin D. Some people just don't like to go outside, they like to sit inside and watch TV and go on gadgets. That's another reason. But in the tropics, we go outside a lot. Why is it then that we have vitamin D deficiency? Well, a lot of us that live in the tropics have a lot of melanin. Whether it is the fact that we are exposed to extra vitamin, UVB rays, where we produce melanin as a protective, element to our skin, preventing cancer, or it is just, evolutionary, where we have lots of melanin. But we have a lot of melanin, and melanin absorbs UVB rays, preventing it from getting lower in the epidermis and kind of preventing vitamin D formation. So how can we now, as highly melanated people, get vitamin D with all our melanin? We can, one, increase our exposure to sunlight, increasing our UVB rays. One can stay outside more, get more sun, and so on. But with getting more sun, you will get lots of UVB rays, but also UVA rays. Some people don't like a lot of UVA rays. It penetrates deep and causes lots of signs of aging, lots of wrinkles. Some people don't mind that, you know what I mean? It's your choice. But other people prefer to supplement with, vitamins. So supplementing at least 1,000 international units of vitamin D per day is suitable for some. All in all, whichever way you choose, you need to get enough vitamin D. When you do your blood work, a level of 30 and above is acceptable. Some books will say 20 and above, but we like to accept 30 nanograms per milliliter as an acceptable blood level of 25 hydroxyvitamin D as being safe to reduce morbidity and mortality. Now, if you got value from this video, go ahead and press the like button and the notification bell so you won't miss another video. See you again next week, same time, same place.